Well, hello everyone. So today we're going to be looking at the sort of central portion of the axial skeleton, looking at the vertebral column and the rib cage. So the vertebral column is made of all these individual bones that provide a lot of support to the body. The skull rests on top of that. The pelvis attaches to the other end of the vertebral column. Your ribs attach to this. So there are a lot of connections to the vertebral column, and it's made of all these irregular bones that are interconnected to one another by ligaments. So your vertebral column has a big job because lots of important structures are suspended from it, and it needs to provide both protection and support and some flexibility to the body. All right. So your vertebral column is broken down into a few different regions here. The cervical vertebrae, cervix means neck. So the cervical vertebrae in your neck, and you can feel the spinous processes on those. If you feel the back of your neck, there are those little bumps. Okay. The thoracic vertebrae connect to your ribs, and they form your thorax or your chest. And then the lumbar vertebrae are in the lower back. Those are real big, thick vertebrae that support a lot of the weight of the body. So you notice it's got vertebrae that start off smaller and get bigger and bigger and bigger as you move down. And then down at the base, we have sort of the wedge of fused bone that connects to your pelvis. Okay, so we can start with some of the different types of exaggerated curvatures that can occur in the spine. A scoliosis is a lateral curvature, so the spine bends sideways, which can cause issues with like nerve impingement. A kyphosis is an exaggerated forward bend, so that's sometimes what people have developing with, say, like osteoporosis. And then a lordosis is an exaggerated curvature in the front for the lumbar spine. So you can sort of extend the curvature beyond its sort of normal S-shaped curve. So you do have sort of a slight sway that you have in here where it sort of helps keep the body, the center of gravity in alignment. So you can have like your heart and lungs and some of your abdominal organs sort of sandwiched in here in this region to help support your body weight with less effort. Let's see. Now let's look at the different regions of the vertebral column. First, we'll start with the cervical vertebrae, again, in your neck. Now, there are two really important named vertebrae that you need to know. The first is the atlas. The atlas has little cups. They're called facets. And the facets in the atlas are oriented so that the pads at the base of your skull allow you to rock your head yes. Okay. So the skull basically rests on these two cups on the atlas, and you rock your head yes. The way I remember the atlas, if you've ever seen the Atlas statue, Atlas is like holding up the world. So you could think the atlas, your top cervical vertebra, holds your world, your skull. Okay. The second vertebra is important. That's the axis. And the atlas sits on top of the axis, and the atlas can rotate around the axis. So I just think the earth rotates around its axis, right? So your skull rotates on its axis. So those top two vertebrae give you a lot of movement in your vertebral column. If you think about the rest of your vertebrae, you can't move the rest of your vertebrae the way you move those top two, right? Those top two cervical vertebrae, you've got a lot of freedom of movement or range of motion. If we move down into the chest, those are the thoracic vertebrae. They connect to your ribs, so they have extra articulations that sort of branch out and that the ribs connect to. Let's see, and then if we move down to the lumbar vertebrae have those bodies that are real thick, okay? And they're massive because they have to support the weight of everything above them, right? So by the time you get to the bottom of your vertebral column, it's under a fair amount of pressure. So those are the biggest vertebrae. A lot of times when people have like back pain, it's because nerves get pinched in between those lumbar vertebrae because it's, again, supporting all that weight. Now, once you move beneath the lumbar vertebrae, the bones are actually fused. So the sacrum is like a wedge of bone that completely gives up flexibility for the sake of stability. You fuse that bone, and what the sacrum does is then connect to your L5 vertebra, and that is your bottommost lumbar vertebra. And then it will connect to another little section of fused bone called the coccyx on the inferior end of that. But the sacrum is important because that actually connects to your pelvis. Let's see here. You see like L4, L5. These are your bottom lumbar vertebrae. There's your sacrum, the wedge-shaped bone. And then we all have a little tailbone called the coccyx. Okay, and the coccyx is sort of a remnant of the tail that we sort of have. Embryologically, you have a tail, and then that tail doesn't really develop, and so it sort of just curves into the base of your pelvis. So we all have a little tailbone inside our bodies, and usually you're not aware of it unless you fall down on your rear end and crack it. Okay. Moving back up to the thoracic cage. These are the ribs that attach to your thoracic vertebrae. Now the ribs will all connect in the back to your vertebral column, but some of the ribs actually connect up front to a bone called the sternum. Okay, so the sternum is actually three bones that are fused together. The manubrium up at the top, so you can feel sort of the jugular notch there. So if you feel at the top of your sternum, you feel that it's got sort of a notch cut out to it, or cut out of it. The body of the sternum, that's what people push on during like chest compressions during CPR. And at the very bottom is what's called the xiphoid process. Okay, so the xiphoid process is what can crack off people are doing like chest compressions. So the top ribs all connect to the sternum, either directly or indirectly. And then you have a couple pairs of floating ribs down at the bottom. So let's look at the manubrium again. There up at the top, you see that jugular notch. That's what you can palpate or feel at the top of your sternum. And then out at the bottom, you feel that xiphoid process. If you've ever gone through training for like CPR, you're supposed to slide your fingers up the ribs and then go 2 fingers up from the bottom. Well, those 2 fingers hopefully cover the xiphoid process so it doesn't crack if you do chest compressions. Let's see. Again, you have 12 pairs of ribs. They connect to the vertebrae in the back. True ribs, if we look at true ribs feed directly into the sternum. So there's rib 1, 2, 3, 4, 5. So it looks like ribs 1 through 5, they run directly into the sternum. And these are what are referred to as your true ribs. Looks like 6 gets categorized as a true rib as well. Now, false ribs are everything else. False ribs include these ribs that have sort of a common cartilage. So if you look at 7, 8, 9, and 10, so these ribs feed into sort of a common cartilage before it connects to the sternum. So these are false ribs. And then now at the bottom, you have these floating ribs. So you have floating ribs in your back that don't have any anterior connections. So in the bottom of your rib cage and back, you feel like these little floating ribs. Okay. Let's see. So that covers the vertebral column and rib cage. So make sure to summarize your notes. And if you have any questions, let me know. Otherwise, have a great day. Thank you.